Hi, everybody. Welcome to 2021. I'm Dr. Schultz with the Centennial Schultz Clinic here in Broomfield, Colorado. And today I'd like to take some of your time to talk about when not to have rotator cuff surgery. High points during this discussion will be what in the world is a rotator cuff? What's the function of a rotator cuff? Are there different types of tears that can impact the rotator cuff? And what is rotator cuff surgery? And are there alternatives? So let's get started. Thank you. So what in the world is the rotator cuff? The rotator cuff is 4 tendons in the shoulder. And I tend to use an acronym, SIT. It stands for supraspinatus, infraspinatus, teres minor, and subscapularis. So let's look at an illustration just to the right. This is looking from the back of the shoulder. And here's the supraspinatus, the infraspinatus, and then this is looking in the front. The front, you can see the subscapularis. So the rotator cuff is 4 tendons that support the shoulder. And the function of the rotator cuff, as I just mentioned, it provides stability to an amazing joint. This joint allows us to elevate, rotate our arm, and as depicted here in this tennis player, it provides an enormous range of motion. And that's one of the other functions of the rotator cuff tendons. So what causes tears in the rotator cuff? There are primarily 3. Number 1 is aging. Number 2 is trauma. Number 3 is overuse. And what's so important and so misunderstood is that with aging of the tendon, there's a reduction in the number of stem cells. And with the reduction in the stem cells, that tendon becomes brittle and fragile. And a brittle, fragile tendon is susceptible to tearing. Now, trauma, that can be from the weekend quarterback, can be from snowboarding or skiing, or from a motor vehicle accident. And you can also assume overuse is in patients that use their arms in construction and or are very aggressive in the gym. There are different types of rotator cuff tears. So if you get the diagnosis, ask more questions. Not all rotator cuff tears are the same. And in fact, there are 3 principal ones that we're going to go over right now. Partial thickness tear, complete non-retracted tear, and a complete retracted tear. So let's take a look. The first of the 3 is what's called a partial thickness rotator cuff. And it just involves a portion of the tendon. And this is illustrated right here. You can see this is a normal tendon of the supraspinatus. The partial thickness tendon tear is depicted here, and you can see it just involves a small portion or a portion of the rotator cuff tendon. This is the first of the 3 types. The second type of rotator cuff tear is a complete non-retracted tear. Now, in this particular type of tear, it extends across the entire body of the tendon, as opposed to a partial thickness. So this one goes all the way across the tendon, but the tendon is still held together by some of the remaining fibers. So let's take a look. Here on the left is an illustration of the supraspinatus normal, and you can see here, this is a full thickness non-retracted. It involves the entire width of the tendon, but the fibers are still intact. And the third type is a complete retracted tear. This type of rotator cuff tear goes across the entire tendon, but in doing so, the tendon rips apart like a rubber band when it breaks. You can see it illustrated here on the right. You can see a physical separation of the 2 ends as they've pulled apart. So again, there are 3 different types of rotator cuff tears: a partial thickness, a complete non-retracted, and a complete retracted tear. So what is rotator cuff surgery? It's actually not just amending a simple suture in the tendon itself. No, it's in the majority of the cases a cutting of the diseased or torn tendon, and then it is inserted into the bone via anchor and sutures. This is a significant and major surgery with significant rehabilitation. It is a painful surgery. What are the problems with rotator cuff surgery? The single most important issue that you need to understand is surgery itself does not address the underlying problem with the fragile tendon. The tendon, because of the reduction in stem cells, is fragile. And if you've ever tried to nail something down that's fragile, the nail may go in, but the tissue separates. So the tendon is still fragile and susceptible to injury. And as a result, it's very, very, very common to have a re-injury or a re-tear of the rotator cuff after surgery because the underlying problem, the tendon remains friable or fragile. So when not to have rotator cuff surgery? If you have a partial thickness or complete non-retracted tear and don't want to have the significant risk and complications associated with surgery, which include re-tearing, you have an alternative. You don't need to have surgery. What is the alternative to surgery? At the Centennial Schultz Clinic, we are experts in the treatment of rotator cuff tears. We were the first clinic in the world to use adult stem cells in the lumbar disc, dating back in 2005. We also have the majority of the publications regarding stem cells on the National Library of Medicine. What are your treatment options? They include platelet, PRP, as well as stem cells. Your own stem cells. That's right, you can use your own tissue to support healing and avoid surgery. Why treat rotator cuff tears? Because it's best to treat small problems early on when they're manageable. Left untreated, a rotator cuff tear can result in a reduction in range of motion, and with it, a decrease in the strength of the muscle and the shoulder. You also are at risk for becoming dependent upon non-steroidal anti-inflammatory medications and possibly opioids. Equally important is if the tear is not treated and it's unresponsive to conservative therapy, that tear may progress. It may go from a partial thickness to a complete retracted tear, and in doing so, you've limited all your options other than surgery. So this is an important problem that requires your attention. So what to do next? Schedule a telemedicine evaluation with a board-certified, fellowship-trained physician here at the Centennial Schultz Clinic. Not all clinics are the same. We have 15 years of dedicated experience. At the Centennial Schultz Clinic here in Broomfield, we are the headquarters for Regenix. It is where all the innovation and lab work is done. This is ground zero. If you actually reside in the Denver metropolitan area, schedule an evaluation in our office. During that evaluation, we hope to exceed your expectations because you will have a thorough evaluation in addition to your shoulder, because many patients have coexisting neck or thoracic pain. You will also undergo an ultrasound of the shoulder, which can give us more information oftentimes than an MRI. If you want additional information, here's our website, centennialschultz.com, Regenix. And if you want to see how our patients have fared following platelet or stem cell, all of our outcomes are published. They're available online, and I've given you the link. Rotator cuff injuries are significant. Rotator cuff tears are different. There are 3 different types: a partial thickness, a full thickness is non-retracted, and a complete retracted. The underlying problem and what leads to a majority of the rotator cuff tears in patients over 40 is a reduction in the stem cell count in the tendon itself, which makes it friable and susceptible to injury. By treating it with stem cells, you improve the integrity of the tendon and in do so have a much better outcome. I hope this was helpful. If you enjoyed this, please subscribe and share it with a loved one. Till next time, thanks so much.